This is Subrat here again, and I'm going to cover one topic. Though I get a lot of questions, but it might not be coming, you might not be thinking that I'll be talking about this. Now, the question was about acid reflux and GERD, or heartburn, whatever you can call that. So now you might be thinking, well, I'm a physical therapist and I am the non-invasive drug-free pain expert. Now why I am talking about heartburn? Well, this is actually personally a big problem for me. Not that I'm suffering with it, but while we are treating, as you know, 98% of our patients are women suffering with chronic pain. That's what we treat here at Synergy Therapeutic Group. So the problem here is when these people, they come here and we treat, I cannot even lay them down in this table. They'll say, well, you know what? I'm not going to lay down. If I lay down, it'll be very uncomfortable. I'll start having heartburn here. Or they will say, well, you know what? I did not sleep whole night long because I was feeling extremely uncomfortable. I feel like throwing up. Sometime they will cancel appointment. So this is actually a real problem. Actually, it's a bigger problem than what you think. So if you have chronic problem or chronic pain, and you must be already knowing, many of you who are watching this video probably already had heartburn or currently having heartburn. So this is the question, and then you might ask, so if somebody is having heartburn, don't you refer it to physician? Yes, I do. But if you go to Google and you search the keyword like heartburn or GERD, first few advertisement actually comes for the medicine. I'm going to talk about that a little bit later. And this is going to be a little bit longer video, and probably I'm going to make a series about it, and this is very, very important. So while we are treating patient here, these people are suffering with chronic pain. As you know already, I talked about this in my other videos, that it is very important we see them very, very consistently, because pain is a process and we are changing the process. So these are not an event like you go there, take a shot, because we have to see them regularly. So if the treatment got interrupted, not because of their fault or anything, they are having the severe symptom, they cannot lay down on back or they cannot lay down on their stomach, it actually poses a very, very big issue for us, how we treat. Now, because of that, if they are not sleeping in the night, and they are not sleeping anyway properly, and to be added problem, it also can create a huge issue, or they'll get sick. I know many people, because of that, suddenly they feel the symptom, then they throw up in the night, then feel kind of burning sensation. It went for 2-3 days, and they took the medicine, and the medicines are not working. Because I know many people that are taking these medicines, especially sometimes over-the-counter, Tums, this, that, Prilosec, all this kind of medication they're taking, it is not helping. They are pretty much the same boat. So before we get into all that, we need to talk about this, what the heck is going on. So it is really simple. Many of you already probably know. So what happened, so in order to digest our food, so we have the whole thing called as the alimentary canal. So alimentary canal starts from your mouth, then it goes through a lot of processes, and it ends in our anus where things get excreted, the waste product. Now, here, the major component after you eat, you have something called as the esophagus, then you have the stomach. So stomach is the one which actually digests most of our food. So in order to, enhance the digestion, our stomach environment has to be extremely acidic. But then the stomach has the protection, so it did not get digest itself. But that kind of protection is not there anywhere else, especially not in your esophagus or elsewhere. So in your body, certain things are supposed to be in the area. So when that is not in the same area, it can create problem. So the acidic environment of your stomach, if some way somehow it comes to your esophagus, it creates irritation because your esophagus does not have the same lining of your stomach which can protect itself. So what really happens, there is a reason, or there are many reasons why the acid kind of comes back to the esophagus. In normal time, it usually does not really happen because that is something called as an esophageal sphincter. That is actually kind of a valve, you can say, or it is kind of a protection. It might be, you can look at like a gate which stops from acid from your stomach comes up to your esophagus. So it stops it. But there are certain conditions are kind of perfect storm brewing. So that is the time actually it pushes the stomach acid back to your esophagus, and that's where you create a problem. So when it comes, sometimes it might feel like a heartburn. Sometimes if it is bad enough, it can wake you up from your sleep, you're sleeping, and suddenly you feel like something is coming up. Then you can feel it in your throat, or there's some kind of food you think, you eat spicy food, there's a lot of meats are there. This is exactly what I'm going to talk about, all this thing today. So, and if you have chronically, but mind you, GERD or any kind of acid reflux, it is a chronic condition. So it does not happen one time. If it happens, it continuously happens. Maybe you'll go for a few days, maybe a week or 2 weeks without having this symptom. Then these symptoms comes back. Then you think, well, I eat a lot of fried food. I should not be eating fried food. Then you think, I'm not going to drink any alcohol, because those things can happen, but there is more to this story. I'm here to explain all that. So then you be fine, then something happens, then the symptom goes high up, and it goes on and on and on and on. But what I'm trying to tell you, though you are taking the medicine, you are trying to avoid the food, but nothing else is happening. But the solutions are actually simple. But before we talk into all that, we need to understand the problem. And I started explaining the problem. So the basic problem is the stomach acid is coming up here. So that is the problem. Okay? So it can happen for many reasons. Okay? So if you are a chronic pain person or having chronic pain, the number one reason why you are having acid reflux, because there are certain medication are actually can trigger all these things. Any kind of pain medication, even if the over-counter medication, like for example, chronically, if you are taking Tylenol, you are taking ibuprofen or any kind of prescription pain medication, or certain kind of medication they actually prescribe during fibromyalgia, that can trigger the, as you know, if you eat a lot of fried food, that can trigger the heartburn or the acid reflux. Or if you eat fried food along with beer or other kind of alcoholic beverages, that can trigger. Soda, it can trigger. And if you are doing all these things, on top of that, you are taking some kind of form of medication every single day, then that can trigger a heartburn. And of course, I talk about this many times in the past, like it begins. So 3 things are very important. So if you are not breathing right, if you are not drinking right, or if you are not eating right, so everything else is going to create problems. So what we are trying to do, we are running around creating or trying to stop the symptom. So stomach, what I was talking about, is a very acidic environment. And actually, if you are eating protein, any kind of protein, it can be meat, it can be chicken, it can be egg, to digest protein, your stomach acid level has to be higher. So if your stomach acid level has to be lower, then it cannot really digest protein. So it has to be highly acidic environment. For whatever reason, if the acid of your stomach will get lower, your food cannot get digested. So it sits quite a bit longer, and that also creates problem. Now imagine any of the medication, especially the heartburn medication you are taking. It can be Tums or anything like that. Those are actually alkaline by nature. So the idea behind it, yes, you are having acid reflux, so you take some kind of alkaline, so it is going to balance out the acid. But when you take these medications, including, so what it does, it actually reduces the acidic nature of your stomach. So it is a catch-22. So you need a lot of acidity in your stomach to digest food. Now you are taking the medication to reduce the acidic nature of your stomach. So because you are doing that, so the foods are sitting in your stomach for quite a bit long time. And longer a food sit in your stomach, that creates problem. That is number one issue, because we are trying to kill the acid in the stomach. That is number one. Now the number two, and all this esophagus and stomach is actually stays. Like if you have here, you have the diaphragm, and here is your stomach. And also you have the esophagus is above the diaphragm. So the esophagus penetrates your diaphragm to get to your stomach. So for whatever reason, if this abdominal pressure increases, that can also cause heartburn, which we see when women, they are pregnant. We see a lot of pregnant women here. So when they are pregnant, so the stomach content create a lot more pressure in the stomach. Or somebody has a bigger belly, they're also going to have heartburn because it creates a lot more pressure. So that actually creates a backtrack to the esophagus. Yes, all these things are there, but another thing nobody usually talks about, if we are not breathing right, or we have kind of a bad posture. So your diaphragm, you might look into my other video when I teach how to breathe right and what are the other breathing exercises we can do. So if your diaphragm is not descending properly, so we have this chest cavity, so we are not breathing from our stomach, our diaphragm is not breathing down. So we are breathing mostly from here. So we don't have enough room in our chest because maybe our posture is bad and the diaphragm is not, so there is a pressure difference here. So when that happens, then your food can regurgitate, or actually the acid can come out over here. So that is a serious problem. So we do not think about all these things. We think if there is an acid reflux, the problem is the food. Yes, food is one of the problem, but not always food is the problem. So if you are not breathing right, no matter how much medication you take, no matter how much thing you do, so your things are not going to change because you are not using the diaphragm, or we are carrying a lot of weight. Well, pregnancy is not a disease, and we know once the child gets delivered, things will come back to normal. But if somebody is not pregnant, so if they're carrying a lot of weight here, so that is going to create a lot of heartburn. So it's not just one thing, and I'm going to tell you what are the things you can do. If you understand the process, it is actually easy to reverse it, and you don't have to suffer. We do these things every single day. So initially it could be hard. If our patient, they follow things, I'm going to tell you all these things, what actually you can do, and things are actually extremely simple. And we just have to be mindful and do few things regularly. Actually, you can get rid of your heartburn. So if you like this video, we have billions of people, they're suffering with this. Share this video with your friends, family, and loved one. If you want to like it, but make sure you comment, because these are the comments. This is how I get my inspiration. I make more and more video. I would have never thought I'm going to make a heartburn video, but actually it is our patient and all the comments I get from other kind of channels that prompt me to make a video. And I thought, yes, it is. I was never really thought we deal with it every single day. So it'll be awesome. So in my next video, I'm going to talk about it a little bit more about heartburn and what we are going to do about it. So if you like and follow me, then you are going to get a lot out of it. So thank you so much. Bye for now.